morning, everyone. How you doing? I'd like to thank the person doing the interpreting today, because we actually grew up 100 kilometers apart. She's actually from Indiana. I'm from Pittsburgh, so it's really close. Take this off first, so I don't hear myself in English. I just have to find the right PowerPoint here, because I think this is it. Yeah. So I'd like to thank Shara for inviting me to come here. This has been a really amazing experience, and I'd like to also thank all the parents who actually took the time to bring their children here. I don't know if you realized how valuable that is, because now they're not going to realize that they're alone. They're going to grow up knowing that this is not a special defect. This is actually part of life, and there's actually other people like them, and that is very valuable. We're going to talk more about how Exstrophy care is done in the U.S. And I could see why, after her presentation, of why it's important here. I really, as a personal level, feel that Exstrophy, because it's so rare, needs to be done at centers where they see hundreds or 20 or 30 cases a year, where you have, it's not just at the surgeon's level, but it's all the way down from the nurses to the staff, and Exstrophy becomes a common disease in that hospital, and not, or a disease process, or a birth defect, and not because it's a special case. So one of the things I don't want you to take from, because I'm not a doctor, I do work in a children's hospital, but I'm a non-medical professional. What the case is I was born with Exstrophy in 1965. That was in a totally different era of what we're dealing with today. So what is going on in the U.S.? Today, if you have a son or daughter with Exstrophy, there's going to be 3 major centers in the U.S. that handle Exstrophy. They probably hold about 30 to 40% of all the cases in the country, and that starts with Johns Hopkins and down in Baltimore, Boston Children's, and out west is Seattle Children's. So, in most of those cases, they also do kind of different procedures. You know, like out in Seattle, they try to do everything in a 1-step procedure, and down Johns Hopkins, they try to do things in a 2-step, meaning it's multiple surgeries. In the past 6 months, I actually used to sing in a group with a director. His grandson was born with Exstrophy in May, and I knew his daughter for years who had the baby. And unfortunately, Foster, I only found out within 24 hours, and I wasn't even able to get Foster to one of those 3 major medical centers, because it's not going to work. Nah, don't worry about it. So just because I'm educated in the subject doesn't mean that you can always be successful in doing it. But the good news about it is he actually is being seen at my hospital, which is Children's Hospital Pittsburgh, which handles some of the cases below. ABC is a international organization based in the U.S. for bladder exstrophy, epispadias, and colloquial exstrophy. And we have about 2,000 people in our database born with Exstrophy. And right now, we're actually reorganizing to become more efficient on the internet base, or more virtual base, because of the changes in the U.S. and changes with the internet. Most people are getting their help through, of all places, Facebook. And unfortunately, the information that's supplied on Facebook is not always accurate. And we're trying to become more efficient in reaching the population. So we're trying to move into doing conferences like this on the internet to be able to be more efficient to get out to all the individuals. And even here would be great if this was actually videotaped to go to the Spanish-speaking world, because there isn't that much out there. Yeah. What I want to show you was as everyone sees, this is a normal bladder exstrophy child, and this picture is actually taken from Dr. William Kennedy, which is actually Misty Blue's doctor, where you'll see her later. Most kids don't have a picture of themselves, and this is actually a picture of myself at age 4. More than likely, none of you should ever have this at age 4 now. You should have been repaired in the first year of life. But it's a good thing to have, because now you can recognize what was going on in your young age, and I don't think it's bad to have. Now, this is actually myself in the hospital when I was little, and then there's my father, and you can see this is about the age of 4 back in 1970. So we're looking at different generations. What your children are going through today should never be what I went through. And that's very appropriate. I hope they don't go through what I did. We want to make sure that we do get the best surgical results for your kids. I'm going to show you this picture because I never had the chance to say, was I alone? Because I'm one of the rare cases, which this is my second cousin, who was born with bladder exstrophy 2 weeks apart from myself. So because of that, I never got to say, why am I here? Why am I alone? I never got to use that excuse because I have a cousin. So, but I also say my doctor, who's now a French chef, and it's always a good one, Chef Cam. When he retired, he always wanted to be a chef. And what better way of doing carving than having a surgeon carve your turkey there at Thanksgiving? And this is actually true for all of us. This past week in the U.S., we had a major holiday on Thursday called Thanksgiving. And this is a way for everyone here to be thankful for life. We should all be thankful for life. This is what we accomplished, was just getting here. We've overcome a lot of obstacles to be here. It's not just our travel obstacle, but in life. So that's why I treasure. Now, I told you about the big 3 exstrophy centers that are in the U.S. We control about 30-40%, and this young doctor down here told me today he was trained by Dr. Hendren in Boston, and they've done really good training and have great doctors in all these different places. But these 3 centers only hold about 30% in the U.S., 30 to 40% of all the cases in the U.S. But the U.S. is massive in size compared to Spain. And 3 hospitals is definitely not enough to be the major centers. I've added Toronto Sick Kids on here because they do train a lot of these urologists across the country in the U.S. too. A lot of them come from Toronto Sick Kids. Toronto Sick Kids have a really great program also. And I work closely with one of the social workers up at Toronto Sick Kids, and we speak together a lot. So I get to know their program, and basically we talk about all the kids that we know together and talk about how they're doing. So, but I wanted to just suggest that there is probably, and this probably doesn't encompass all the hospitals in the U.S. that deal with exstrophy, but this is probably the next top 10. And like I said, I work at Pittsburgh Children's, which our medical director for the hospital is actually a Johns Hopkins trained urologist. So we do see some exstrophy kids, and we do have a really brilliant urology department, but they're not probably the top echelon in exstrophy. But they're brilliant surgeons for other things. So, like I said, whatever I would say, don't take me as a medical professional, please, because don't take that medical advice. Don't go back to your surgeon and say, I need to go to the U.S. because Tom said. Please don't. You have great surgeons everywhere, and if we can get to a great critical mass of patients coming to 1 or 2, 3 hospitals, the success rate will go up in closures, and we'll have reoperations of exstrophy. And I see the future being bright in that respect. And in the U.S., in the U.S., we also have a lot of programs for kids with intestinal and urinary diversions and with exstrophy. We do have a camp out, or 2 camp outs for families with exstrophy in the U.S. And actually, you'll see Misty Blue and myself later speaking at a couple. And we also, another group runs they call youth rally, but it's really like a camp which they go onto a college campus like this and live in the college campus for a week with kids that have many disorders, not just with exstrophy. But 25% of the people that come there do have exstrophy. One of the things that got me when we were interviewing was every parent of what you remember, what you went through right after birth, if you weren't pre-diagnosed by ultrasound, what you went on as you delivered, finding out that your son or daughter had exstrophy. I know that was a traumatic experience, but I didn't get to live it until I interviewed Mia. Mia told me down step to step what happened because it's fresh in her mind. And I have probably about an hour worth of videotape that we're going to present to her son 10 years from now of what was like and what he went like through those first few days of life. And it was just a thing, but what I'm saying is no matter how educated the people around you are, you cannot get them to that top 3 or 4 places that if you find in Spain without educating the other medical staff around, the obstetricians, the gynecologists, the midwives, if there's a lot of midwives in Spain. To get to the correct places, you need to educate those individuals. And I think that's where the partnership with the surgeons and the medical community will come in handy here in Spain, where it's come in handy in certain places in the United States. And I know that Johns Hopkins actually has a financial data sheet on why it's important, because here in the U.S. we pay for our own insurance, or our insurance company pays for it. So it's a lot easier going to the insurance company to say, and it should be for the government too, that say if you take them to these 3 places, the success rate of first closure will financially save money to the system or to the insurance company. And I think that's another approach you might want to take when you start looking at those 3 or 4 centers. Because if you have a critical mass in education, I really personally feel that the radiologists, the nurses, the child life specialists, if there's child life specialists here, is very important to the success of that family. I think with exstrophy and other birth defects in that system, it's a family that needs to be treated, not just a child. Because a lot of the siblings become resentful to thinking that their brothers or sisters are getting special treatment. And as patients, we know that's not true. But so why would the siblings would actually think that is because all they see is them going away, maybe going out of town, and they don't understand why. And in the same respect, the parents need to be supported of what they're going through. So I believe in that team concept. And I think that's another benefit that's not always taken in advantage when you're looking at centers. And I used to say centers of excellence. And in the U.S. that's a term, but we don't have official centers of excellence for exstrophy. But when you have a center for excellence, everyone on the team becomes excellence, and not just the surgeon. And that's where and that's personally coming from me personally feeling that it starts from the surgeon down, but everyone needs to be a part of it. And if you take anything from me closing this week is to think that the positive outlook for your children is very positive. There's a lot you can do to help them, but there's a lot you can do to be a part of it. And I believe that the best support you can be there is just to be there for your children. Just to be there for when the questions come. Just to be there for the support. So I believe I'll wrap this up now so we don't take all the time up. And I'm sorry, I apologize for the video, but I will be around for later today. We're going to speak, but at any time, feel free to come up and talk to me. Feel free to come up to talk to Misty. Feel free to come up and talk to anyone. And for everyone that's new here, anyone new, first time? Yeah, first time new, there we go, here we go. Now, my one advice, and I always say that at these events, before you leave today, make sure you have a phone number of someone you've talked to and you can trust, because they will come in handy in the future. And don't leave this weekend without getting your questions answered, either by through the doctors or through family or through even rare diseases. It's that this is an opportunity you can't pass up. And thank you for inviting me again, and I appreciate it.